Questions 681 to 700. 681. Patient with BP 230/180 is consider blank. The answer is hypertensive crisis. 682. A newly assigned nurse to the home healthcare department was conducting pre-entry phase of home visit. Which of the following activities should the nurse do? A. Call physician for a referral order. B. Collect information and schedule visit. C. Establish mutually acceptable goals for care. D. Conduct a health history and physical assessment. The answer is B. Collect information and schedule visit. 683. A mother brought her 6-month-old healthy infant to the Well Baby Clinic. Which immunization should the nurse anticipate to administer as per her recommendation? A. Varicella, chickenpox. B. Rotavirus and hepatitis. C. Measles, mumps, rubella. D. Diphtheria. Tetanus, pertussis. The answer is D. Diphtheria. Tetanus, pertussis. 684. The nurse is teaching a 32-week pregnant woman how to distinguish between pre-labor, false, contraction and true labor contractions. Which statement about pre-labor contractions accurate? A. They are regular and increase gradually. B. They are felt in the abdomen. C. They start at the back and radiate to the abdomen. D. They become more intense during walking. The answer is B. They are felt in the abdomen. 685. A 62-year-old woman admitted to the emergency department for the 4th time this year. Each time the patient comes with severe injuries and bruises in the body. What is your responsibility as a nurse to prevent such incident to happen again? A. Reports the assault to the local police and write a report. B. Provides information about safe shelter and support. C. Instructs the woman to move away from her home. D. Discharge the patient to a safe shelter. The answer is A. Reports the assault to the local police and write a report. 686. A 3-year-old child is admitted to the hospital with seizures. He was alert, oriented and has a rash in his extremities and is diagnosed with meningitis. While doing physical examination of him, he starts to develop seizures. Blood pressure 100/57 mmHg, heart rate 110 per minute, respiratory rate 30 per minute, temperature 39.5 C. Which of the following vaccine is used to prevent meningitis? A. HIB vaccine. B. Varicella vaccine. C. BCG vaccine. D. Rubella vaccine. The answer is A. HIB vaccine. 687. After receiving multiple mosquito bites and experiencing flu-like symptoms, a patient consults a nurse at a clinic and asks whether an appointment to see a healthcare provider is necessary. Which of the following statements should be the basis for the nurse response? A. Antiviral medications can be prescribed to destroy virus. B. Clinical signs can be mild flu-like symptoms to fatal encephalitis. C. If patient has West Nile virus, symptoms will progressively worsen. D. If patient used insect repellent, virus would have been destroyed when mosquito made skin contact. The answer is B. Clinical signs can be mild flu-like symptoms to fatal encephalitis. 688. A male client has received a prescription for orlistat for weight and nutrition management. In addition to the medication, client states plans to take a multivitamin. What teaching should a nurse provide? A. Be sure to take the multivitamin and the medication at least 2 hours apart. B. As a nutritional supplement, orlistat contains all the recommended daily vitamins and minerals. C. Multivitamins are contraindicated during treatment with weight control medications such as orlistat. D. Following a well-balanced diet is a much healthier approach to good nutrition than depending on a multivitamin. The answer is A. NS to take a multivitamin. What teaching should a nurse provide? The answer is A. Be sure to take the multivitamin and the medication at least 2 hours apart. 689. Which of the following variables is considered as a major factor that affects community health? A. Personal behavioral choices include socio-cultural factors. B. Number of healthcare providers in hospitals within the community. C. Quality of the public safety officers includes police officers, firefighters. D. The number of recreational services in the community. The answer is A. Personal behavioral choices include socio-cultural factors. 690. During meningitis outbreak in one of the hospitals, the non-immune staff were given an immunoglobulin in order to prevent them from the infection. What is the type of immunity that will be developed by these staff? A. Active. B. Long-term. C. Natural. D. Passive. The answer is D. Passive. 691. The surgical unit nursing staff were instructed to follow the hospital protocol by reporting cases of any patient's illnesses that are developed during their hospitalization, especially the post-surgical wound infectors. Why must the nurses implement this protocol? A. Control unnecessary hospitalization. B. Assess hospital infection rate. C. Report nosocomial infection. D. Improve reporting system. The answer is C. Report nosocomial infection. 692. Which of the following statements indicate that a nursing staff need an education session related to confidentiality and information security? A. Giving the password to patient's family member. B. Leaving the computer in the nursing station secured. C. Leaving the personal electronic password safe. D. Allowing nursing students to read medical record to their patients. The answer is A. Giving the password to patient's family member. 693. Which of the following is the best action to effectively increase surgery capacity? A. Adapt outpatient departments for inpatients. B. Bring the injured people into the green zone. C. Provide care for the injured people with the available staff. D. Use the available supplies as it is difficult to arrange for additional. The answer is A. Adapt outpatient departments for inpatients. 694. A patient has been experiencing recurrence of this media antibiotic therapy and the patient was scheduled for preparative teaching. The patient asked the nurse about the purpose of the procedure. What is the best answer that the nurse should provide? A. It stimulates motion of the ossicles. B. Detects permanent hearing loss. C. Allows drainage of purulent fluid from the middle ear. D. Enables medication administration directly to the affected ear. The answer is C. Allows drainage of purulent fluid from the middle ear. 695. After accessing patient's medical records, which behavior nurse shows that patient's confidentiality has been breached? A. Reviews patient's medical record. B. Read patient's care plan. C. Disclosing patient's information. D. Documents medication administered. The answer is C. Disclosing patient's information. 696. A nurse is assessing a 2-day-old full-term male knee on circumcision. She observed that the circumcised area is a large amount of fresh blood. Heart rate 110/min. Respiratory rate 40/min. Temperature 36.67 C. Which of the following action should the nurse take? A. Apply antibiotic ointment on the affected area. B. Give the infant another injection of vitamin K. C. Clean the area with betadine to prevent infection. D. Apply gentle pressure with a sterile gauze. The answer is D. Apply gentle pressure with a sterile gauze. 697. Nurse manager prepares unit clinical operational plan. What is top priority in the plan? A. Infection control. B. Staff orientation. C. Quality projects. D. Safe patient care. The answer is D. Safe patient care. 698. Nurse is caring for a child with a diagnosis of pneumonia. The plan of R includes nebulizer treatments and chest physiotherapy. When should the nurse perform chest physiotherapy? A. Prior to the nebulizer treatment. B. After the nebulizer treatment. C. Intermittently during the nebulizer treatment. D. Continuously during the nebulizer treatment. The answer is B. After the nebulizer treatment. 699. While taking the history from a new patient, the nurse densified that he had hypomanic episode, which was alternating with a mirror depressive episode for the last 2 years. What is the most likely diagnosis? A. Bipolar 1 disorder. B. Bipolar 2 disorder. C. Dysthymic disorder. D. Cyclothymic disorder. The answer is D. Cyclothymic disorder. 700. A 65-year-old woman visited the gynecological outpatient history reveals that she had 3 pregnancies, 1 abortion gestational age, had 2 normal deliveries. She smokes 20. Her complaint is that she wets herself when she cough, embarrassing for her. Which of the following can be considered as risk factors? Pelvic floor muscles. A. Chronic coughing. B. Diabetes mellitus. C. Excessive spot. D. Sedentary lifestyle. The answer is A. Chronic coughing.